And it's my absolute delight and honor to call upon Dr. Evan Adams, who is the Chief Medical Officer with the First Nations Health Authority, and Dr. Perry Kendall, who is the Provincial Health Officer for the Ministry of Health. They will be, it's been 10 years, as you know, since the signing of the Transformative Change Accord and First Nations Health Plan, and 5 years since the signing of the Tripartite Framework Agreement on Health Governance. And Dr. Evan Adams and Dr. Perry Kendall will be speaking about the new set of indicators on the health and well-being for Indigenous people in British Columbia. So let's show our doctors some love for coming to the stage to share their wisdom with us.
I'm so happy to be in this very beautiful territory and to present some ideas to you today. We really took Joe Gallagher's challenge to us very seriously. We've been living and breathing this for many months, trying to present to you some of our very best ideas around First Nations health and how to measure it, how to get a sense of it. So we have about 30 slides to present to you in about 45 minutes. Unfortunately, we don't seem to have a lot of time for discussion. And you'll see we're going to present a number of ideas to you. And we would like to let you know that we'll be available after the talk and throughout the course of the morning to speak to you about some of the ideas here. Yeah, thank you. So in March of last year, we held a workshop, Perry and I, to discuss the partnership between our offices, me as the Chief Medical Officer and Perry as the Provincial Health Officer, to start planning for all our futures and to look back at the last 10 years. And this is a diagram of some of that discussion. I just wanted to show to you, this is a 10-year plan looking forward, that wellness was very much a part of our goal. Partnership that we, the First Nations, and we, the First Nations Health Authority, are not the only players in the health of our people. There's a huge health system, and the provincial government and the federal government, and of course other British Columbians who are a part of our wellness. And so I'm just pointing out a couple of parts of the graphic. So during that time, we had time to reflect on the last 10 years. And the last 10 years, of course, represented a number of key agreements. It involved literal negotiations. You can't hear me? Oh my gosh. I should know that this is a directional mic and to speak into the mic. How's that? Better? I feel bad for you, Perry, because I'm really quite sick and my lips are touching this microphone. Oh, good, he gets his own.
Got it covered. I read his mind. That's yours.
Is it on?
I know I shouldn't be here. I'm being kind of a Typhoid Mary. No, actually, I did speak to my senior medical officer for communicable disease. He said, I've been sick for a long time, so I'm not really contagious. I'm dying, but it won't affect you.
I'll let you know tomorrow,
Evan. One of the key questions that we've been looking at is health governance. Who's in charge of what? And of course, with the First Nations Health Authority and having First Nations people in charge of their own health, governance is a very, very central issue to our health and well-being here now in BC. And that First Nations interests are being hardwired into the health system in BC. And I think it's important to acknowledge and to celebrate what we have all accomplished collectively, and we'll be describing some of those accomplishments in the next little while. We've been working very hard.
So before I get into my part of this, I'd just like to acknowledge that I live and work on the unceded traditional territory of the Coast Salish people, and I thank you for inviting me to be part of this great gathering, and I'm very honored to be here. As Joe said, I've been part of a journey with the First Nations Health Council I was fortunate in that my office was able to bring on Dr. Adams as an Aboriginal physician advisor. I think we were even more fortunate that as we moved on over time, I was able to get this position authorized as an Ordering Council Deputy Provincial Health Officer with all of the powers and authorities under the Public Health Act. And the third and really important piece, in 2014, we signed a memorandum of understanding and mutual accountabilities between my office and the First Nations Health Authority, and established the position of Chief Medical Officer of Health in the First Nations Health Authority. So Evan and I have had a great and wonderful ongoing partnership.
Great, thank you. And as partners, we are stronger together. We're able to provide health system and public health leadership to advance First Nations health in BC, and we are true partners on this, and we speak often, we speak easily, and we're very proud of that process and that partnership.
And before we move on, I would like to acknowledge the team that worked hard to pull this presentation together. So from Evan's side, I'd like to acknowledge the Wellness Manager, Lindsay Beck and Catherine Berry, and Deputy Chief Medical Officer, Dr. Shannon MacDonald. And the team also included Harmony Johnson, Executive Director of Policy Planning and Transformation, and Judith Engelbrod, Laurel Lemchuk-Favell, Rebecca Love, Ashraf Mohammed, and Megan Misovich. And from my team in the ministry, Adrian Bonfonte, who's the Manager of Projects and Reporting Initiatives, Dr. Shannon Waters, who is our Aboriginal Physician Advisor, and prior to her coming to the office, Dr. Danielle Ben-Smith. So,
thanks, Perry. So let's begin, and thank you. A lot of people really contributed to our look forward and our look back. So today marks a milestone moment. 10 years ago, we weren't as organized as we are today. 10 years ago, we didn't have a chief medical officer at the FNHA or an Aboriginal physician advisor. We didn't have deputy and nearly the number of staff that we have. We didn't have regional processes. And we have this unique partnership between the Ministry of Health and the First Nations Health Authority to look at the health of First Nations people. So we stand on this stage, or we sit on this stage together, uniquely positioned to plan and to dream, and to be very bold about what we can dream and what we can ask for. And it is time for us to declare a vision for the next 10 years to transform First Nations health in this province in a way that has not been done heretofore. And this isn't, of course, just for us. This is an agenda or a set of indicators that hopefully will light a fire in you, and one that you can use in your work in the coming while. And we hope that you will be inspired by some of our collective thoughts and ideas.
So Joe set us a challenge back in March to come up with a visionary, challenging set of goals for the next decade. And we want this to, we've worked on doing this. We hope that it will support the First Nation Health Authority's vision for healthy, self-determining, vibrant BC First communities, children, and families. We want to establish a renewed set of broad health and health determinants indicators that we will be able to measure and report on regularly over the next decade. And these were built on the basis of the 7 health indicators that Joe talked about, which were established a decade ago as part of the Transformative Change Accord. And just to refresh your memory, we had the 7, they're here. Some of them are still problematic, but by measuring them, we've been able to focus the work in the regions, particularly I'm thinking about infant mortality. Others, we achieved really, I would say, marked success. This is a graph that looks at youth suicides in First Nations communities in BC. The top line is where the trend was moving before the Transformative Change Accord was signed. The red dotted line is the path that we would have had to follow to halve the difference between First Nations youth suicides and non-First Nations youth suicides. And the bottom green line is where we are actually moving. So here we've achieved, and we're looking to achieve what we set out to do, which was to halve that tragic difference. The next indicator I would just briefly talk about is the diabetes incident rate. The top line shows the rate of new cases of diabetes that are diagnosed for Indigenous people in BC over time, starting way back in the 1990s and moving up to 2014. The lower blue line shows the rate in First Nations people, and you can see that around 2011, that number stopped growing and is now coming down for both First Nations and non-First Nations people in BC. We are seeing fewer people being diagnosed with late onset diabetes, which I think is a tribute to the health and wellness programming that's been going on in this province.
Thanks. So those are just a couple of the old indicators. So what about some new indicators now that we have some new abilities to monitor our own health, and we have some new investment to make improvements that we then want to measure? We just want to assure you that the renewed set of indicators and associated reports will bring together the knowledge base to support and inform policy initiatives and approaches, much like you're going to be discussing in the next little while, at various levels, like at a community and nation level, and within and across sectors and levels of government. And we say knowledge as opposed to evidence or health indicators, as it includes quantitative data, which tells a certain side of the story, but also leaves room for Indigenous knowledge and ways of knowing. For instance, stories as evidence, real-life cases as evidence that can demonstrate our points and point us in certain directions. And that our indicators are very firmly based on the First Nations perspective on wellness, which you see pictured here.
And as Joe said, and as we have said, we were challenged to set up indicators which would challenge us, which would reflect health status, which would reflect the agenda of looking at the broader determinants of health, and which would also reflect the path to reconciliation and full healing. So as we did last time, we have established what we propose we should be measuring. And having done that, we would like to spend the first year establishing targets as to where we would like to see ourselves in a decade. And we work with the regions to develop the actions and recommendations that would drive towards those targets. And we plan to report, or we commit to report on progress every 2 years.
Great. And so we commit to this idea of honoring two-eyed seeing. Two-eyed seeing is learning to see from one eye with the strengths of Indigenous knowledges and ways of knowing, and from the other eye with the strengths of Western knowledges and ways of knowing, and learning to use both these eyes together for the benefit of all, particularly our populations. And this is an idea that comes from Elder Albert Marshall of the Mi'kmaq Nation, an idea that we can use two different sets of knowledges to make decisions. And this means that through the development of our indicators, we will aim to balance Indigenous viewpoints and approaches with Western ones. So, peeling back the layers. As we approached our challenge of building a renewed set of indicators, we started by looking at the original 7, and we asked ourselves, what happens when we look beyond those, and what happens when we examine what's behind those original 7? And what we see, of course, is a very complex picture. Here are the social determinants of Indigenous health as described by Dr. Margot Greenwood at the National Collaborating Centre for Aboriginal Health at UNBC in Prince George. And when we use this diagram, the social determinants of Indigenous health can become very complex and very overwhelming. But this is our work. The simplest way to look at this is to ask, what are the factors that affect our lives? And if we really want to be holistic, then we're looking at all of these, how they impact us at an individual and at a collective level. And what's important about this is that we have the standard or the usual social determinants of Indigenous health on the outside, things like education and employment, but there are also Indigenous specific determinants like racism, dislocation, self-determination, and even colonization itself. And these are described in black. You'll see those in black font, and you'll see them also way in the corner in a little box. You can also see the interface. The kind of cream-colored ring is the interface between non-Indigenous and Indigenous systems. And in this interface, we contemplate the idea of cultural safety and humility, two-eyed seeing, which is, seeing with a Western set of knowledges and an Indigenous set of knowledges, reconciliation, where we make peace with what's come to pass, and we make peace with our non-Aboriginal neighbors. And we try and bring together two different viewpoints, the difference in perspective between First Nations, or maybe First Nations clients, and others, perhaps non-Aboriginal caregivers. So the outcome is significant and persistent health disparities and inequities experienced by our people. And these are the types of things that we wish to draw attention to with this diagram, with the 7 core indicators, and with the new indicators that we're going to be putting forward. I also want to remind you that it's not all bad news. The social determinants of Indigenous health also describe protective factors, ideas like culture, resilience, good physical, mental, spiritual, physical health, and strength and resilience.
And in my first PHO report on Aboriginal health and wellness, which was released in 2001, while of course drawing attention to inequities in health status and inequalities in health status, it also pointed out that those gaps were closing, and they were closing because of the resilience, the capacity, and the strength of First Nations people in British Columbia. We also looked at Indigenous health around the world, and the key features that came out of that review is that when health programs are designed by, are governed by, and are delivered by Indigenous people, they work. They are the most effective way of developing these programs. And the First Nations Health Authority is clearly an embodiment of this. It's a health authority for First Nations, by First Nations. And although it was important to acknowledge the disparities and inequities to catalyze system change, we want to keep pushing and drawing attention to the fact that there are also determinants such as self-determination, culture, and connection to one another that make us healthy, well, strong, and resilient. And these are clearly linked to improved health and wellness outcomes. So the indicator set that we are proposing will look at those determinant factors, and although we may not be able to directly monitor or to control or deliver them, they are important because they build into the way in which people do become and will become healthy.
Thank you. And we can't overemphasize this enough, and I know you get this from Joe Gallagher whenever he speaks to you, that when we speak about health issues like, say, diabetes, we must really talk about diabetes and wellness. Or if we speak about mental health, that we speak about mental health and wellness, because there are protective issues. There are things that we do well at that need to be described and studied too. So, shifting the paradigm. So we are meant, in part, to focus on wellness outcomes and not just sickness, disease, and deficits. And it means bringing attention to the fact that there are many of us who are well, many of us who are at home and away from home, who have had success. We should celebrate and explore those. We should commit some resources to strength. We should commit some resources to resilience and to building. We should commit some resources to sharing with each other. And we should commit resources to spreading the idea of wellness. How do we share our success with each other? And so we commit to doing so with this renewed set of indicators.
And before we get into describing the individual indicators, really wanted to talk about the framework we did for this, which was an adaptation of the First Nations concept of wellness, which we have put in that frame at the left, the big square at the box. So we used this framing to develop and select which indicators we would recommend and pick. And the most important thing to note, I think, is that they were really informed and guided by the perspective on wellness. And all of these areas, of course, are interconnected and interrelated. But to go into it in a little detail, the outer gold section or ring in the concept represents the key principles that we used to choose the indicators, and it also includes the principles that guide our partnership in the work. The middle column with a blue, green, and red represents the three rings in the perspective of wellness. The blue is the social, cultural, economic, and environmental determinants, the more upstream ones, the more upstream factors. The green box represents land, family, nation, and community. So they are the determinants of health that are closer to home or more proximal to people. And then in the red, we have the mental, physical, spiritual, and emotional factors of wellness, which would include behavior, resilience factors, physiological factors, etc. And the left column, which is the light blue, represents the health system, which we wanted to draw special attention to. We have a couple of indicators that Evan will speak to, which will be measures of how well the health system is responding and whether that is effective or not. And in the right-hand column, orange, we will have some health and wellness outcomes that we'll be measuring. How did we develop these indicators? Well, we started off, the working group had a selection of almost 50 indicators to look at. And we, after weeks of work, we actually narrowed those down to 15. The work, I hope you will agree, has been heavily informed and inspired by the wellness indicator development work that the First Nations Health Authority has been leading over the last few years, which has included engagement and discussion at both the regional level and at gathering wisdom forums such as these. And although our working group worked with almost 50 potential indicators, they whittled them down to 22, which they presented to Evan and myself, and we ultimately landed on 15. If people want to know what criteria we used to whittle them down, we'd be happy to talk about that perhaps afterwards or later. But now I'm going to hand over to Evan, who's going to walk through the indicator set that we're proposing.
Great, thanks, Perry. And I'm sure that there would be a lot to talk about the indicators that didn't quite make it. In part, it was because they were being measured elsewhere. And so you may see some areas where you would think that we would be doing indicators, but they're being measured elsewhere, and so we're covered. But please come and speak to us and let us reassure you. So the next 13 slides are mine. The camera, if you want to come in for a single close-up, that would be great. So under social, cultural, economic, and environmental indicators, or the outermost ring of the First Nations perspective on wellness, we have education, graduation rates, food security, and adequate housing. Education is one of the most important indicators of health because higher educational attainment can increase a person's future income, occupational opportunities, social status, and all of which are very well proven to contribute to improved health. And we will use Aboriginal graduation rates for this indicator data from the Ministry of Education. High school graduates can be classified as either first-time graduates or as students who are eligible to graduate. First-time graduates, of course, are students who are being eligible to graduate for the very first time. They've just reached grade 12, while those who are classified as being eligible to graduate includes both the students that are returning to school as adults and those who are graduating for the first time. Food security, or physical and economic access to sufficient nutritious food to meet dietary and food preference needs, is a key socioeconomic determinant of health. Without it, people can experience malnutrition, unhealthy pregnancies, suboptimal child development, and greater rates of chronic disease. And we will use self-reported ability to afford or eat a balanced diet for this indicator from the Regional Health Survey or from the Canadian Community Health Survey. Thirdly, adequate housing is also essential for health and well-being. Aboriginal people are more likely than non-Aboriginal people to live in houses that are crowded, in need of repair, or consume more than 30% of their household income. Inadequate or crowded housing can be associated with various health issues and affect wellness. And we will develop an indicator using census data for percentage of housing that does not require major repairs such as defective plumbing, electrical wiring, or structural repairs to walls, floors, and ceiling. Great, the next slide. Cultural wellness. We are proposing a combined single indicator that looks at traditional language, traditional food, traditional medicine and healing, and a sense of belonging in one's community. And this is one of the most important indicators in this set. And I'm sure that you have an opinion on this. Communities in touch with culture report a much higher level of health and well-being. Cultural identity and practice are both protective and remedial, so ultimately strengthening language and culture is essential for improving health. And doing so can ease intergenerational traumas, promote holistic healing, rebuild self-esteem, and restore pride. And I just want to point out that on the other side of the slide are Aboriginal knowledges, including stories. So what are the stories, hopefully contributed willingly by many of you here, of cultural wellness, of language, of traditional food, of traditional medicine and healing, and a sense of belonging in your communities. Language is the conveyor of culture and the means by which knowledge, skills, and cultural values are expressed and maintained. We transmit health knowledge using language. And there are several ways which this indicator can be measured, and we're still exploring these. So for instance, the Regional Health Survey and the census include questions on exposure to First Nations languages and the ability to understand, speak, read, and or write these. Under food, or traditional food, an important indicator identified through community engagement, and as you know, traditional foods are low in simple carbohydrates, high in protein and fats, and they are very healthy. And additionally, the production and harvesting of traditional food promotes activity and exercise and family bonds, and which is itself recognized to be beneficial to health in the broadest sense. So physically, spiritually, emotionally, and mentally, a connection to our cultures, identities, languages, land, and foods benefits us. And for this indicator, we'll use data from the Regional Health Survey, which asks how often people eat their traditional foods. Medicine and healing. First Nations communities within BC have said loud and clear that they want more access and better support for traditional wellness practices from their homes, including traditional healing and traditional medicines and the use of traditional practitioners. And we want to know if we're making gains in this area. And to develop this indicator, we will use data, again, from the RHS, which asks people, in the past 12 months, did you use traditional medicine? Last in this category is the sense of belonging. Research shows that belonging to social groups and networks is just as important a predictor of health as our diet and exercise. And so inclusion in our societies or exclusion from our societies has a bearing on health. This indicator will be developed using data from the RHS and the CCHS, which asks how well people feel connected to their local community. Here are two health system indicators: cultural safety and humility and preventable hospitalizations. And in large part, action on health system performance indicators is being undertaken at the level of the regional health authorities and will be measured by a set of indicators within the evaluation of the tripartite framework agreement. However, we wanted to draw attention to the following two key indicators. Cultural safety and humility must be, the health authorities have signed on to this, must be embedded in the healthcare system in order for First Nations and Aboriginal people to attain optimal health. And this means care providers should be free of racism and discrimination, that they bring respect to the client encounter, that they be open, and that patients feel safe when receiving health care. Providers should also be respectful of local culture, local languages, and local traditions, and we want to be able to track this. And so we will develop an indicator by using data from the Patient Reported Experience Measures Survey, or PREMS, and this asks patients in acute hospital settings if they felt they were being treated respectfully. The second indicator is preventable hospitalizations or avoidable hospitalizations. Ambulatory care sensitive conditions are chronic medical conditions that, when treated effectively in community settings, should not, in most cases, advance to hospitalizations. And these are referred to as avoidable hospitalizations and are considered an indirect measure of access to primary health care in the community and the ability of the healthcare system to manage chronic conditions. Chronic conditions include many health issues, including asthma, diabetes, COPD, and heart failure, just to give you a few examples. This data will come to us from the Ministry of Health. Under Land, Family, Nations, and Community Indicators, which is the second outer ring, or the third ring if you're coming from the center, we have two indicators we're suggesting: decision-making, human and economic capacity, and ecological health. Decision-making, human and economic capacity. We want to draw attention to the fact that strong and resilient communities are protective of health. We're exploring what a combined indicator might look like for this, and might include things like self-government, community control over police, fire, and health services, education, etc. Really, this indicator will reflect self-determination. Ecological health, or the health of the land is the health of the people, is the foundation for health and wellness of First Nations people. The land is the source of life, culture, tradition, law, food, medicine, and we want to develop an indicator that represents the health of your territories. For instance, percentage of undisturbed habitat and abundance, number of animals that can be harvested each season, and or the abundance of culturally important species like salmon or moose or elk, or whatever you may feel is important to measure in your own territories. Great. Under mental, physical, spiritual, and emotional indicators, which is the second ring in the First Nations perspective on wellness. It's the ring just outside of the center, which is the human being. So under mental, physical, spiritual, and emotional indicators, we have three: physical activity, oral health, and smoking. Physical activity is important for reasons that most of us know. It reduces a person's risk of heart disease and stroke. It improves physical fitness, bone health, and mental wellness. It prevents high blood pressure, abnormal cholesterol, diabetes, and helps us maintain a healthy weight and activity and increases our mobility. And we'll develop this indicator using data from the Canadian Community Health Survey for off-reserve people and from the Regional Health Survey for on-reserve people. Oral health is an integral component of physical, mental, and social well-being. Its primary role is in preventing tooth loss and subsequent malnutrition, and having good oral health helps protect people from pain, from a diminished quality of life, from diabetes, from cardiovascular disease, and lung disease. Third of all, smoking. Commercial tobacco or using tobacco in a non-traditional way, or the abuse of tobacco, has been a major contributor to cardiovascular and respiratory disease, to many types of cancer, and to chronic diseases like heart disease and diabetes. And I don't think any of you would argue with us that we need to continue our efforts to prevent smoking. And we'll develop this indicator using smoking status, or the percentage of people who don't smoke, data from the Regional Health Survey. Under health and wellness outcomes indicators, there are 4: healthy birth weights, alcohol-related deaths, injuries, and self-reported mental health and well-being. Healthy weights for babies, not too big, not too small, are very important for children's future health and development. And birth weight is also an important marker for the health of mom. Perinatal Services BC provides a valuable source of information on First Nations babies, and we're able to ask for data about babies that are born underweight, normal weight, and overweight. In our look, Perry, at First Nations health in the province of BC, there are a few that are more dramatic than alcohol-related deaths. Alcohol-related deaths have been slowly but significantly declining since 1996, but alcohol-related deaths still remain several times higher than alcohol-related deaths for other British Columbians. We still need to talk about alcohol in our communities, in our families, and amongst ourselves. Injuries requiring hospitalization is one of the top causes of morbidity and mortality amongst First Nations people, and I dare say we haven't done a great job thus far of measuring those injuries, and we'd like to do better. We'll use the discharge abstract database at the Ministry of Health to help us with this, and that database records the conditions that people were diagnosed with when they left hospital. Fourth of all, self-reported mental health and well-being is a good indicator of health. Considering yourself mentally well means that you are taking pride in who you are, no matter where you find yourself physically. That you are taking pride in who you are, that you are enjoying life, that you're forming and maintaining satisfying relationships, and that you're coping with stress in a positive way, striving to realize your potential and having a sense of personal control. And we'll develop this indicator using data, again, from the RHS and the CCHS that asks people to rate their mental health on a scale from poor to excellent. And I should remind you that, again, Aboriginal knowledges, including stories, will be part of the data that we'll be collecting.
So thank you, Evan, for setting that out so clearly and well. I'm hoping that you will agree that what we have proposed today is a really broad and comprehensive set of indicators. I'm not aware of any indicator set that attempts to capture so many of the very specific determinants, whether they're proximal or distal, and measure health outcomes and looks at the performance of the healthcare system as well. It's a challenging agenda. I think we'll be working very hard to capture. We'll be working hard in the first year to establish what goals are reasonable, where do we want to set targets, and how do we get there, and what programs do we need to put in place, whether they're delivering services, changing services, or advocating for better services, better housing, better access to resources, control over land, et cetera, et cetera. So we really hope as well that we've moved away from a kind of strict deficit space, looking at illness or failure to achieve, to something that will capture a positive move forward, that'll capture environmental change, social change, and the broader determinants of health, and that will also address the move forwards towards more cultural healing and wellness, and by which we'll be able to measure the progress through reconciliation and hold all partners accountable. So, and we hope, therefore, that it'll contribute to our joint vision of healthy, self-determining, vibrant BC First Nations children, families, and communities.
Thank you, and I just want to reassure you that these are only core indicators. It doesn't mean that we won't be measuring other health indicators or other social determinants of Indigenous health. These are really just the emblematic ones, the core ones that we'll be reporting on quite frequently. And I just wanted to comment as well that one of the indicators that didn't quite make the list, and you may feel otherwise, and we're happy to hear from you on otherwise, was violence against women. And we felt that family violence and violence against women was a really core issue for us, but that would be measured in some other places. And so it doesn't appear here. But that doesn't mean that we won't be talking about that. In fact, our next joint report is on the health of Aboriginal women in the province of BC. So the last slide of all, we wanted to end this presentation with a story that would remind us of the wholeness of what we're trying to approach. We had a contest to see if people would share with us some stories of their health and well-being. And this little gem came in from a Nisga'a woman named Rose, and it's very brief, and we'd like to play it for you. I'm not sure.
My name is Rose Patterson. I am Nisga'a. I am the granddaughter of Frank Calder and Dorothy Clark. I find wellness very important, that one should incorporate first within themselves. I do this well by going for walks and returning to the land, as I did and grew up in Vermont. I am part of the 60 Scoop, and I was adopted and raised in Vermont, where we had no electricity and we grew everything we ate. Coming here to Nanaimo and working with the First Nations, I have found, as I return to my people, that this too is very important to all. Learning how to fish, using all the herbs and plants is very important, and knowing how to take care of oneself without always returning to westernized system is very important. Connecting with family and children and elders is also very important to me, and I also encourage this as I too walk in wellness when returning to my people here. I find it very important that we all take care of each other and work together as we find wellness as one. Thank you.
Yes. And so you can see that she takes a lot of responsibility for her own health and well-being. You see that she describes the colonial experience of being scooped and of being adopted out. But she's also the picture of resilience. She talks about growing her own food. She talks about physical activity. She talks about transmitting and acquiring traditional knowledge. She talks about relationships and not losing sight of our cultural inheritance. And she says we needn't look to Western society for all the answers that we seek in our health and well-being. And last of all, she talks about belonging and being from a particular place and a particular family. And I think most important, she says, we all must work together as we find wellness as one. Thank you.
So I'd just like to close by saying it's been a privilege and an honor to be part of this process, and I thank you very much for allowing me in. Thank you.
Thank you.
Thank you so very much for sharing an amazing vision and food for thought and further personal inspiration. At this time, it's my pleasure to call on 2 members of the First Nation Health Council to give you a token of their appreciation on behalf of the First Nations Health Authority.